Good morning, everyone. Aaron welcomed you this morning, our acting superintendent. I'll repeat that. Welcome. And this is so exciting to be part of this forum today. I've been working now in this park for 30 years, and we've been very deeply engaged in healthy parks, healthy people for the last 5 or 6 years, and it's really been a battery charger for some of us who've been here for a long time to understand that parks and health is the ultimate natural partnership, and it has the power to make real change in life, the lives of people, the people we serve. Our health partners here in the room, and I really, really appreciate them taking time out of their busy schedule. Our park partners, we all know the business we're in, and that's to keep people healthy, happy, and well. So, our panel today, we have an excellent, excellent panel. You're in for a treat. This session is called The Power and Apex of Partnerships. Now, the apex, of course, is the high point of the pinnacle of a geographical shape, oftentimes a pyramidal shape. The apex is at the top. And this may be a little bit of hubris, if you will, because there are many, many kinds of health partnerships. This supposes that one called Park Prescriptions, or Park RX, is one of the highest manifestations of it. But there are many manifestations. We saw that. Nina presented to us a whole array of types of programs around the country. Dr. Razzani gave us that fabulous presentation that set us up for why we're even doing this work. And Nushin was in my office, 6 or 7 years ago now, and we actually decided we wanted to do one right here at Golden Gate National Recreation Area. And so we believe in health and parks, obviously, and we also believe that park prescriptions and what park prescriptions are is part of that message. So, here's how we're going to define park prescriptions for the purposes of our presentation today. Programs designed in collaboration with healthcare providers and community partners that use parks, trails, and open space to improve individual and community health. That's just a working definition. Park prescription programs take many forms, but this is kind of what they're about. Our goal in doing a park prescriptions program in our agency, and probably your agency, because I know many of you out there are working in the direction of park prescription programs, is to make sure that our park agencies inject and accentuate health as a core mission of what we do. And another element of it is the process by which health providers actually prescribe time outdoors and in nature for all the reasons that Nushin told us is important. Health providers are actually directing people into our parks and into our programs. So that's what we're going to be talking about today. We have a terrific panel. Immediately, I'm going to introduce the panelists, and then I'm going to invite each of them to come up in turn. I'm going to introduce all of them right now. I'll start with Carol Johnson. Carol's the Assistant General Manager at East Bay Regional Parks. She is an absolute Healthy Parks, Healthy People champion and has been for many, many years. East Bay Regional is one of the leaders in this movement, and Carol's one of the leaders within that great organization. I've had the pleasure of working with Carol for many years. She developed the Healthy Kids Challenge program at East Bay Regional Parks District. And we saw some slides about some of the manifestation of the partnership between Benioff Children's Oakland and East Bay Regional Park District, and Carol has her fingerprints all over that. She's going to lead us off in just a second. Sitting next to Carol, to your right, is Remy Mercer-Slomoff. She is the clinic manager at the Marin City Health and Wellness Center. And if those of you who have been to Marin City know that it is a vibrant place, it's a happening place, and there's a whole lot of things going on with it. And a lot of those can be credited in many ways to Remy's work. She began, after graduating from UC Berkeley, she tried her hand with teaching with Teach for America, and understood that morphing from that, she always having an interest in public health, decided that that was the direction to go. And so she's been focusing on health ever since that time. And she's now, as I say, with the Marin City Health and Wellness Center. And they are in the process. It's a real-time effort now to create a park partner program, and we'll hear about that. Jim Wheeler, immediately to the right of Remy. Jim is a kind of stalwart in parks and recreations here in San Francisco. He heads up the aquatic program. He's the Leisure and Aquatic Services Manager for the San Francisco Recreation and Parks Department. He is a very accomplished aquatics practitioner himself. He's also a leader in the National Recreation and Park Association, California Park and Recreation Society. He's a park leader and has had a great deal of experience with park prescriptions programs here in San Francisco. And then our anchor man today will be Dr. Curtis Chan. And again, we have a panel filled with health champions, and Curtis is right there in the front ranks. Curtis is the medical director of maternal, child, and adolescent health with the San Francisco Department of Public Health. I know Curtis for his boundless energy and enthusiasm around the power of the outdoors and time in the outdoors and time in nature to keep people healthy, and particularly children, which is his primary experience base. Curtis is going to be our anchor man today. So I'm going to start off with Carol Johnson to give a little discussion on the experience of East Bay Regional Parks with a park prescriptions program. Carol Johnson.
First of all, let's give a round of applause for Michael. How do you feel? I feel great. And I also want Michael's business card because I am bringing him back to some of the rather boring meetings that we have back at the Park District. So keep that in mind. To my two colleagues that I'd like to introduce today that are here also with me and are our co-collaborators in everything that we do for parks prescriptions and healthy parks, healthy people. Mona Coe, who's our community relations manager. And David Zuckerman, who is the manager of our recreation and interpretation programs. So I'm going to talk a little bit about, I'm just going to hold this because I feel like I'm leaning. All right. So what I'm going to talk to you about today is kind of where we have been and where we are now and what we look forward to doing. Our whole goal of working with healthy parks and healthy people started many years ago with the attendance of an international conference in Australia by several of our, well, maybe not several, I don't want to say that public employees go to these international events a lot, but our park general manager at the time, Pat O'Brien. He brought back this phenomenal idea of healthy parks, healthy people that had been going on internationally, and we immediately jumped on board and said, hey, that actually is a bucket that we should be doing here. Fast forward, just maybe 3 weeks ago, our current general manager, Bob Doyle, just got back from Hawaii from the similar international conference that was hosted this time by NPS. Thank you for the very first time NPS hosting this, to talk about healthy parks, healthy people internationally again. So much has been going on, and now our whole country is engaged. So what does it mean to us? Here's what a snapshot of what healthy parks, healthy people looks like to the Regional Park District. We have several little buckets that I will share. Environmental education, that is Dave Zuckerman's specialty, is one of the buckets. And in that is the Kids Healthy Outdoors Challenge, again, something that we created the last several years to get kids and their teachers to spend more time outdoors with the classroom curriculum. So that is part of our Healthy Parks, and we are working with over 3,000 kids every year to get them into our parks. That is an aside from the 50,000+ kids that come to our parks as a regular field trip. Secondly, we have been working, as Nusheen said, with Children's Hospital on a health study, which I'm really excited we're going to be launching the results of to our board of directors and then externally in the upcoming months. We also implemented with this group, Healthy Parks, Healthy People Bay Area, the Saturday programming, which includes getting kids and their families out to the parks through Children's Hospital, that shuttle program that Nusheen discussed. We are also working with various community clinics, and I'd like to give a shout out to Cindy Chow, who's also here from Contra Costa Health Services. We have been working with their organization as well to get people in their mindfulness clinic and their obesity clinics out to our parks too. And then we are working with those clinics as well as Nusheen's clinic on actually putting imagery of parks indoors in their centers. And I can just say as an aside, just last week I had a blood pressure checkup. My doctor called me to come back in because I had a high amount with my recent wellness check. I went in, my blood pressure was still high, and as I sat there getting tested for the second time, and this was at Kaiser Hospital, so shout out to Kaiser, I had the opportunity to look in one of their exam rooms, and lo and behold was a beautiful picture of nature. And I sat there and I pondered, wow, this is really cool because we're doing this too, you know? And after 10 minutes, I took and retook my blood pressure, and it had dropped 10 points. So it works. And then finally, the multicultural wellness walks that Mona is very much involved in is really interacting with the various community groups through the community leaders, through the ethnic media leaders, trusted leaders of the multicultural communities within the two counties we serve, which is Alameda and Contra Costa counties. Amazing walks that are generating 100 or plus people every time we go out, and then they finish their wellness walk with a breaking bread together of some cultural food. This is what the prescription toolkit looks like. Here's a bit of the audiences that we're targeting: children and families with chronic illnesses. That's the model that we're using with the UC Benioff Children's Hospital, and doctors and healthcare practitioners. With respect to Cindy's group, we'll be working with the doctors and healthcare practitioners there in Contra Costa, and we are working with other community groups such as Tiburcio Vasquez Community Clinic and La Clinica de la Raza and others. The nature graphics is part of our toolkit. Brochures and flyers, which you saw some of the brochures that Nusheen showed. Bus transportation is part of our toolkit, a very important part of our toolkit, and that's where our foundation comes in to fund it. Lunch active programs, and of course the research study. This is a little bit about the research study. I'm not going to go into it because we've heard some great information from Nusheen, but this is essentially some of the toolkit information that we've developed that has been very well received. Here's a little bit about what the nature graphics looks like. This is a picture of me and President CEO Bert Lubin of Children's Hospital, and in their primary care clinic in Oakland, where we installed a variety of beautiful images that not only benefit the patient and their families, but also the clinicians and staff that work there. Here's what one of the rooms, the exam rooms, might have in it. Would be some park-specific imagery and map And it was so exciting to hear when Nusheen called and said, you know, we're so excited about this. We want to rename our exam rooms after our local parks. So this is a bit of a diagram of all the different colors, or the different colors of representing a different park. And those exam rooms have relevant imagery and information about those parks. At Contra Costa Health Services, which we're rolling out now, here's a sample of what some of the imagery is going to look like. And we are working very closely with the organization so that they select. We don't tell them, but we give them options, they select. And every location has specific parks that are close by so that the patient and staff can appreciate nature nearby. Getting into some of the programs that we offer with Healthy Parks, Healthy People, and Parks Prescriptions is the Shine Shuttle program that Nusheen already mentioned, the warm welcome that is provided by staff. Once the bus gets there, the kids and the families are greeted by a park staffer. There's an icebreaker type of game that goes to make people feel comfortable and inclusive. There's a healthy lunch that is provided, an interpretive walk, quiet time for discovery, especially for the little ones who really want to be able to kind of do some of their own thing under supervision, and then the connection to nature. And then final is the heart circle to share experience in nature. And this is where some of the more exciting and rewarding comments have come from the participants. Speaking about the multicultural wellness walks, these are sponsored by Kaiser Permanente, so thank you again to Kaiser and the Regional Parks Foundation. We piloted these 2.5 years ago, and we have had an average of 90 to 100 plus participants every year from a variety of communities, Latino, Asian, African American, Middle Eastern communities that are all coming together. And included in the walk is a little bit of a unique experience. It's not just a park naturalist taking people on walks. We're actually bringing doctors in to actually teach exercise somewhat like we had with Michael, maybe not the thriller type of dance during these healthy wellness walks, but they're teaching yoga. We bring in acupuncturists, nutritionists, Zumba instructors, laughter yoga, and family games, so that it's all part of the exposure when people come for these wellness walks. The Kids Healthy Outdoors Challenge, as I mentioned, is something that we started within the last several years, kind of as a follow-up to a very popular program called Trails Challenge, where it was a self-guided walk that people can take on their own pace, and if they hike a certain number of trails a year, they get a certain type of prize. And so we decided we needed to do something for kids. So we wanted to embrace teachers and how they teach, so that is where our focus is, of providing guidebooks for both student and teacher, teacher training by our naturalists as to how to interact with nature and or use nature as a teaching tool for those teachers that are not accustomed to being outdoors. And then we provide field trips to these students and an evaluation follow-up so that we can understand how the workbooks and the guidebooks and the teachers' involvement is being impactful. So far, we've had 1,000 kids a year. I think we're up to about 3,000 kids overall in the program. So these are just a couple of the toolkits that we provide at East Bay Regional Parks. We're always looking for new things. We're looking for new partners. And I just want to give a final thank you and shout out to our favorite partners who have already spoken today, Nusheen Razani at Children's, San Francisco State, National Parks, and HPHP Bay Area, Kaiser Permanente, of course, too. So we look forward to more interaction with these folks as well as others. Thank you.
Thank you. Thank you very much, Carol. When you looked at her slides, and Carol could have given you a day and a half seminar on what an agency that is all in on healthy parks, healthy people produces. So you were seeing sort of an exceptional model there. You may have noticed when I introduced our panelists that it was sort of park person, public health person, park person, public health person. So you got a snapshot here, and this is what it was, a snapshot of an agency that really has a very well-articulated park prescriptions program. Now we're going to hear the public health side from Remy Mercer-Slomoff, who's with the Marin community. Marin City Health and Wellness Center.
Yep.
Thank you. Thanks for that tutorial. Anyway, Remy.
Thank you. All right, good afternoon. Hi, as Howard said, thank you again. I'm Remy, I'm the clinic manager of Marin City Health and Wellness Center. And I'm here to represent the clinic, but also showcase the Parks Prescription Program that we've implemented in our community with help from so many fantastic partners, and we will I'll talk about that in a couple of slides. Oh, no, other way. There we go. All right. So the Marin City Parks RX group came together to promote park equity and eliminate health disparities for African American communities, specifically Marin City residents. The goal was to engage Marin City residents to increase park usage while improving overall health outcomes. Marin City was the focus of this Parks Prescription Program because of its unique demographic profile. For those of you who don't know Marin City, we're right across the bridge. Marin City is unincorporated and is the lowest income area in Marin County. Marin City also has the largest concentration of public housing residents, a population that the clinic specifically was part of our mission in founding the clinic to serve that population. 24% of families in Marin City are living in poverty, compared to 3.5% in greater Marin County. In terms of health data, adult obesity rates in Marin City are 60%, childhood obesity is at 38.9%. Life expectancy in Marin City is 78.6 years, compared to a nearby community of Ross, which is 94.4 years. Through a grant from the state of California, nearly $5 million was secured to design and renovate a park in the center of Marin City. It's called George Rocky Graham Park. And right off the bat, it was evident that this park renovation could and should be the catalyst for future change. Numerous partners and community members came together to design the park, which also sparked improvements of nearby trails, linking Marin City to the Golden Gate National Recreation Area. The park was built to include walking loop mile markers, exercise equipment, cushioned turf, and playground equipment, as well as hydration stations. Additionally, the Marin City Health and Wellness Center secured funding for a health educator. I started at the Marin City Health and Wellness Center as the health educator, and I have now passed the baton to my colleague Gabe Schur, who's in the audience, who's the new health educator at Marin City Health and Wellness. So the health educator was brought on board to work as a liaison between the patients, the providers, and the parks programming for the Parks Prescription Program. Prescriptions come from any provider in the clinic. They could be medical providers, dental providers, or behavioral health providers. Now we're even working with our substance use disorder program to provide prescriptions for our Parks RX. We're focusing on 4 primary chronic conditions, focusing on diabetes, hypertension, obesity, and depression. Individual care plans are created for each patient with health action plans included. Patients are referred to activities based on their physical capability and their time constraints, and then biometric data is collected by the health educator. So we collect hemoglobin A1C data, we collect blood pressure data, we collect BMI, and PHQ-9, which is a patient health questionnaire with 9 questions for depression index. This is the way that the prescription goes through the system and at the clinic and into the parks programming. So it starts with a prescription, goes to the health educator. The health educator meets with the patients for about an hour. They do a health action plan, and then it goes into biometric data recorded and followed by the health educator, at which point they determine what activities are best for that patient, and they are referred to those activities. Okay. By tapping into park funds from a recent Marin County Measure C funding, the county has been able to offer twice monthly Saturday programming in the park. And so using the park as a trailhead, the Golden Gate Parks Conservancy offers walking groups. They start at Rocky Graham Park and they walk up into the park area surrounding Marin City. We have some amazing trailheads there, so we're able to offer that, which is fantastic. Additional funding from programming comes through Marin Community Foundation, with these programs provided by local residents. Programs are offered year-round and almost every day of the week. A typical week for Parks Prescription in Marin City, we have a Kokoro class, which is a healing and empowerment class. Twice a week, we have walks 2 to 3 times per week for patients or community members. We also offer hikes. Specifically, once a week, we have a hike on Wednesdays. We have a gentleman that comes out from the national parks, and yoga and Zumba once per week each at the center, at the park. There we go. All right, less than 1 year into the program, we have the following results to report. 42% of the participants are Marin City residents. 40% of participants are African American, 42% Caucasian, and 10% Latino. The majority of the participants are 61 years of age or older. So we are seeing an older population, 61 and older. We're seeing about 7% of our population is youth under 18, but that's a growing group that we're trying to work on growing that a little bit more. Our second largest group is 46 to 60 years old. We track our data using the electronic health record at the clinic, and our health educator tracks visits and vitals for each patient. We also record all visit notes in our EHR so we can track it internally as well, and keep track for that patient. We print all of their action plans for them each time so they can have their own action plans and take ownership of their health as well. We use an Excel document to track data for patients in the program. That's the A1C, the PHQ-9, the BMI, and the BP. And we do follow-up visits with our health educator. So a few of our participants have really taken to the program and are participating at an even greater extent than we originally planned. We actually have some participants who have begun leading walks or hikes themselves, and others who have recruited friends or other community members to join in on the activities. Providers are incredibly satisfied with the program because they can see medically significant effects. So many people came together to put this Parks Prescription program into motion, and just to name a few, the Marin County Park supported the program through Measure A funding to pay for park programming. Marin County Health and Human Services supports the program through in-kind staff time, nutrition education through the CX3 program, and Rethink Your Drink demonstrations at our events. In addition, Health and Human Services provided a grant to support the health educator at the clinic. Marin City Community Services District implements parks programs and identifies locations for activities, helps implement the nutrition education program as well. Marin City Health and Wellness Center staffs the health educator role and tracks the biometric data. We also staff the providers, and we provide the prescriptions. Golden Gate National Parks Conservancy is a partner with Healthy Parks, Healthy People, and the Park Stewardship Program, and they committed staffing support to the program. One of their program leads is who leads the park walk on Wednesdays, the hike on Wednesdays. Additionally, the Trust for Public Land worked with the community on building Rocky Graham Park and is a continual partner in what we do in the Parks Prescription Program. I think that's it for me. So I want to just say a quick thank you to all of my colleagues who are here, both from the clinic and from the Marin City Parks Prescription Coalition, if you will, our group. And thank you to Donna for inviting us to speak today.
Remy, thank you very much. I think you can see the passion in her face, and the outcomes that are in progress are very impressive. And it also, to me, this demonstrated the way the different building blocks of partnerships come together. It's the institutional partners within the county, it's the clinicians, it's the park, and they all come together with a goal to improve the health and get good health outcomes, and you're obviously succeeding, so thank you very much. Let's give her a hand. I mean, parks and health people are appreciative people, so let's also give a shout out to, you mentioned Trust for Public Land. We had the pleasure of working with TPL a little bit on the Rocky Graham Park, but they deserve a real shout out, so TPL. Thank you. All right, our next speaker comes back from the park, he comes from the park world, San Francisco Recreation and Parks Department, Jim Wheeler. Jim has been sort of in on the ground floor on park prescriptions at the Recreation and Park Department. And we've worked together on various programs. The first Saturday program, we worked on some big national conferences. Let me invite Jim Wheeler up.
Thank you. Hi, I'm here to tell you that parks make life better. I have the honor right now of being the president-elect of the California Park and Recreation Society. Thank you to the staff that showed up today. From CPRS, health and wellness is important to recreation and park departments across the state, and we continue to work harder and harder to try and bring things like this to the forefront so people understand some of the things I'm going to talk about. I always feel funny when I'm on panels with people with lots of letters behind their name. The letters behind my name are ADHD. And if you've ever sat with me for 5 minutes in a meeting or try to stop me to talk to me in a room like this, you figure it out very quickly. My whole challenge in life was pretty much changed by parks. I grew up, thank goodness for my family not having a lot of money. We never went to Disneyland. We went to Shasta, we went to Lassen, we were in the Boy Scouts, we went to Mount Diablo, Pinnacles, Big Basin, Calaveras, Big Trees, Point Reyes, and then my local parks, Brioni, Shell Ridge, Las Trampas. I even got married at East Bay Regional Knox Miller Park. So parks are it, and parks really helped us get out and do some things. It's funny that if you ever watch some of our largest corporations in America advertise for their services like Visa, all you ever see is people on bikes and hiking on trails and experiencing the things that our parks provide. They sell their business on our experiences, and so I think it's really important to understand everybody feels that connection when they see those. And as our good friends at Kaiser say, thrive. So our journey into health and wellness, we reorganized in 2010. Prior to 2010, maybe you had a rec center that had somebody who liked to camp. Maybe you had a rec center who had somebody who liked to do yoga. But nothing really was formalized. As we reorganized, we hired citywide coordinators for health and wellness, citywide coordinators for outdoor programs, extreme sports, alternative recreation. I was lucky enough to be moved from the parks management side into a newly formed division called Leisure Services. And so some of the strides we've made happened because we created a health and wellness unit. We introduced yoga and Pilates into a lot of our centers, but really it all started for us with a lady named Willa Zhu, who was a Harvard fellow at the Recreation and Park Department, who really helped us with a program called Movement in the Park. And Movement in the Park led us to think other things. $350,000 later from the Soda Coca-Cola Foundation. Sorry, health and wellness people, but we took their money. We started what we call the Mobile Rec program. Mobile Rec serves over 10,000 kids a year. It is not a parks prescription program, but it is definitely about taking experiences to underserved and marginalized communities and allowing them to experience rock climbing and riding a BMX bike and slacklining and paddling a kayak and all these different things we do. So we're pretty proud about that, and some of it does get them outdoors. Where it really turned the corner for us was the Community Transformation Initiative and our partnership with the Department of Public Health, where I met one of my best friends in the city, Curtis Chan. Without Curtis Chan, and we probably wouldn't have really figured out how to roll into Healthy Parks, Healthy People so fast. It all made sense. Active zones made sense. Mobile recreation made sense. But we rolled that into kind of bigger things. We currently do Zumba in the park. We have 35 free Zumba classes a week in parks across San Francisco just to try and get people outdoors and moving in parks and rec centers. We partner with San Francisco State University and help facilitate 100 Citizens, which is a program out of the kinesiology departments of state universities where they work with local partnerships and parks to provide boot camps and exercise programs for people on the ground. We have free water exercise programs in conjunction with the YMCA in Bayview, and we have swimming programs for obese youth that are free and structured after school for kids in the Bayview also. The most exciting thing for me personally right now is the Recreation and Park Department is one of the core team members along with many other groups in the Cities and Children's Nature Network movement, where we're really trying to figure out how to make every single blade of grass a learning opportunity and a nature thing in cities and try to get some equity and access. It fits into our mission pretty well. We met our friends at the Institute at Golden Gate, formerly Kristen Wheeler, now Donna. Thank goodness for them and their support. Okay, this is how it fits into our strategy, everything underlined. I got the 5-minute sign. I feel like I just started talking, so here we go. The one thing I do need to recognize today is if you get the opportunity when you break out this afternoon to go and listen to Lisa McHenry, you really need to. She is our HPHP hero. 150 Saturdays this woman's met people in the park and walked in the last 3 years. Okay. I firmly believe that health and wellness is a basic human right. And I believe that we need to utilize public resources to provide equitable access to parks and recreation where people feel safe and welcome and they can improve their lives. This is the foundation for everything we try to do in connecting people to outdoors and providing health and wellness and working with the public clinics. You know, the benefits of being outside and walking programs are pretty obvious and have been expounded by many different people. I think it's more important to realize that parks prescription is not a new concept. In 1901, a very famous person said, wilderness was a necessity for tired, nerve-shaken, over-civilized people suffering from the vice of over-industry and the deadly apathy of luxury. Thank you. John Muir, people like John Muir, doctors like Silas Weir Mitchell, who first prescribed the Rest Cure or the West Cure. These are pioneers, and this is 115 or 20 years ago. People realized, and of course, as Emma Maris says in her book, The Rambunctious Garden, which you should really read, she called him the Wilderness Cultist Supremo Teddy Roosevelt. So this has been going on for a long time. Okay, what do? We do 4 walks a month, and we do them in unique locations. We try to put them in all different portions of the city. We have 2 over in Bayview Visitation Valley area, and then we have 1 in Golden Gate Park, and we have 1 at Lake Merced, which is our gem over in the Sunset area. The 4 walks, we did one every Saturday. We thought first Saturdays were good, but when we penciled it out, the budget-wise to pay the time for someone to organize and a outdoor person and a wellness person to meet and take people on the walks was really rather inexpensive. And I'm not going to say how much because inexpensive might be different to different people, but we really feel so strongly that people need access and they need to be able to feel safe and welcome and get out in the parks that it was important to us. 70% of our participants feel more socially connected to their neighborhood, which we thought was super important. And 84% said they attend the walks for the healthy benefits and the walks are enjoyable. More importantly, we asked how did people find out about our walks. 53.8% heard through social media, For us, we're very excited as we move into, prescribed exercises at various stages in various places across the Bay Area. For us, there are 10,000 employees between the Department of Public Health and the Recreation and Park Department and 11 clinics. And so our move hasn't probably been as fast as we would like it to be, but we are there, and Curtis will talk about that in just a second. So we're very happy. Some of our testimonials: lost 50 pounds, wonderful walks. Thank you so much for your time today, and thank you so much for coming out and understanding the importance of this huge societal issue.
You may have noticed the name Curtis Chan has come up a lot. And that's because in San Francisco, Healthy Parks, Healthy People, and the park prescriptions programs, and the partnership between park agencies like San Francisco Recreation and Parks Department, National Park Service, and others, with this, those partnerships really can be credited to a really large extent to the work of Dr. Curtis Chan. So Curtis, why don't you bring us home on this leg of the presentation.
Thank you, Howard, and thank you all for all your contributions and wisdom. So I think I want to tie some concepts together from the panel as well as our wonderful speakers in the morning. But before I begin, I think you can just tell that the elements of the slides is from a whole group of people, including Lisa, Jim, and I highlighted Laura Brayden Rodriguez, who's in the back. She's our coordinator of our NEOP program in San Francisco, the Feeling Good Project, and it's her and her staff and her team that have really made this go in San Francisco. So kudos to you all. One thing that I think that's important for us to understand as a group is to understand that there's actually probably 3 sectors here, because I know that some of the speakers were talking about parks and healthcare, but I want to just say that there's probably at least 3 sectors: parks, healthcare, and public health. And I think I want to just distinguish health between public health and healthcare. Many times they're blended together, but just for me even to identify our leadership in Laura, she's a leader, I would say, in all of San Francisco in public health, community health related to nutrition and physical activity. And the point is, too, that this is through a federally funded USDA NEOP program, and there's that same structure in every county in the Bay Area. There's a NEOP program, as there's a public health department, as there is a Kaiser. And I think the reason why I'm highlighting that, it's important when we're trying to identify partnerships, because this afternoon, we're going to try to actually make some of these concepts gel together and think about how we can make further social change much more beyond park prescriptions, which is a wonderful start. So that's the game. There's 3 sectors. Just want to get a sense, who's in the first sector? Parks, raise your hand. Great. The second sector, public health, raise your hand. Good, so almost about equal amounts. And the third sector, healthcare. So much smaller, right? Okay, good. And that's really important, because a lot of our investments in our community is in healthcare. A lot of the resources are there, and that's also where our most vulnerable and sickest patients go for their care. But they're not here because they're taking care of patients, right? So that's why those of us here in public health and parks, and with our healthcare leaders who are here, need to continue to work together to think about the concepts that Dr. Roberts and Dr. Razani highlighted in the beginning. So I actually didn't greet you yet. The greeting I have today is good day, Seleki Atsa. Can you say Shaleki Atsa? Can I hear it? Shaleki Atsa. So that's the Ohlone word from the Coastanoans for good day. And the Coastanoans used to live right over here close to the natural resources. Right? So I think that's why we have so far still to go, because access to nature shouldn't be that hard, but I don't see probably that many Native Americans living here now because they've been displaced. And really, that's starting 7,000 years ago, 2,000 years ago, and it still persists today. And the way we construct our cities in urban areas to be close to natural areas of recreation and beauty, the same history keeps on replicating itself. So our pathway to creating park prescriptions, this is a symbolic effort for a much bigger picture, but you all as park and recreation leaders, community leaders, and public health leaders, we have this opportunity to make that symbolic difference. So in your packet, so this is the eventual product of the great work of Jim Wheeler, National Park Service, National Maritime Museum, the Golden Gate National Recreation Area, and the Presidio, what's that called? Presidio Trust. What's that park over there? I'm blanking out. So it's this one-page prescription that we hand out to our community. Right, so it has a lot of the concepts that Dr. Rosani taught us about on the very top. It's on the right side of the folder. Increasing physical activity, reduce stress, maintain healthy bones and muscles, and socialize. Right, so this has been distributed through to basically all of our Medi-Cal providers in San Francisco. And the reason why we're able to distribute it is that all the park agencies, state park agencies, local city, county park agencies, and the federal agencies have worked together to be under one single branding, Healthy Parks, Healthy People. So it's no longer all these, so they're able to provide consistent programs throughout the year, free and low cost. They're trying to make it increasingly accessible. There's a welcome. And there's this commitment to welcome people who have been underrepresented for years. So I think those are the policy institutional changes that have been decades in the making, but in the last 3 or 4 years, it's our leadership in the parks departments here in San Francisco who've made that happen. So I think once all these policy changes have been made, it just becomes a lot easier for healthcare providers to prescribe something because it's something consistent, because our park providers don't have time to remember this special event that happens on October 26th. We have a special event. They're not going to remember that, and our families who are most stressed in our most stressed communities are not going to remember that and attend. Right? We have 900,000 people here in San Francisco, millions in the Bay Area, millions of them are in poverty and very, very stressed. So, and on the other side, this is something that's been done by planning in Department of Public Health, is try to incorporate, so how many of you here have heard of the term collective impact? Raise your hand. Good, more than half of you. So how many of you have implemented collective impact? Raise your hand. Good, about a third or less. A third of those. So most of you have heard of collective impact. I've been trained so many hours on collective impact. So that's the way to go in the future, results-based accountability. How do we actually implement it together? So this is kind of like our first or second draft of how parks and healthcare have implemented collective impact for healthy nature walks. There's two parts, parks and healthcare. I'm just going to show you 2 slides that's going to be important for writing grants, talking to your boards. This is the National Prevention Strategy. It's done by, it's a cabinet level, US cabinet level people. The major, so it's the Department of the Interior, the Department of Health and Human Services, but basically the federal government describes these 2 areas. And the 2 things on the top is to create healthy and safe environments. The thing on the right is clinical and community preventive services, right? So that's the parks and healthcare piece. And that's the different parts of our, that's on the left, that's what public health does. On the right, that's what our healthcare services does in San Francisco. So this document is there that you could just look up National Prevention Strategy and you'll see this. So I'm putting this up there to take up my time, but also to show that you've at least read it. So you can see the first thing is encourage community design and development that supports physical activity. And the number 3 thing is facilitate access to safe, accessible, and affordable places for physical activity. And number 5, what the clinicians can do is assess physical activity levels and provide education, counseling, and referrals, right? So as a pediatrician, I'm not going to, I might not assess for social stress and lack of physical activity if I don't have a good concrete referral to send my patient to. So the people who are able to create that systems are the park systems. So I'm just going to go back to this document instead of doing the rest of my 10 slides. And it's to show you, this is how we've kind of mapped it out. That parks and healthcare now have this shared agenda. And I would actually offer to you that Jim Wheeler and Recreation and Parks Department actually is more able to reduce the prevalence of depression, anxiety, toxic stress, social isolation, chronic disease, and physical inactivity than any physician in San Francisco or any specific health program in San Francisco, right? By making these walks available, it actually allows folks a place to go for their New Year's resolution, the people who have been most socially isolated. And you could see these mutually reinforcing activities on both sides. That one, there's a yin and yang to this. One needs to happen in order for the other one to happen. So this is the concept. And you can still see that there's a lot that we still need to develop in terms of the 5 conditions for collective impact. The 4th one is continuous communication. And the 5th one is a backbone agency within San Francisco and within each of the sectors, parks and healthcare. So I just want to shift a little bit right now from my talk. And so we feel pretty confident that collective impact is the way to go. We feel that the magic that's happening in these Bay Area counties, 9 counties, 25 plus park agencies, has been really led by the Institute at Golden Gate. And I would say 4 or 5 years ago, it was really like the wisdom and inspiration of Howard Levitt, who would stand up in front of the room and highlight his vision, be gentle. And I think the thing that he emotes the most of is respect for each other, and that really dovetails nicely with what Dr. Nina Roberts said about trust. So when we trust each other and we respect the different expertise that healthcare, public health, and parks has, things can start progressing. After decades of wanting to do things together, things are happening not just in San Francisco, but in every single Bay Area county. And at every single meeting, Howard's really there, because we didn't totally introduce Howard yet, so I just wanted to spend my time to introduce him instead. So, and I think one thing about collective impact is that it doesn't have a sprinkle of that essential piece that I also have for Jim and Lisa and all of our partners, is that respect piece, and that respect builds trust and understanding. So I think from now on, instead of calling it collective impact, which is branded, I'm going to call it co-Levitt impact. So that's collective impact with lots of respect for each other. So.
Thank you very much, Curtis. There is a huge mutual admiration society between Department of Public Health, Curtis, Laura, others, and our park. So, you've listened to us for a while. Lunch is about 15 minutes away. However, here's your chance to ask Carol, Remy, Jim, and Curtis questions about a Park Prescriptions program. This was just the briefest of all possible snapshots, and it's always frustrating a little bit from a panel point of view to have to condense it so much. We have the afternoon to talk about some of the mechanics of this. But are there questions now? I have a list of questions, but I want to hear from you. What questions do you have of any of these panelists or a question that they can all toss up. Please, and identify yourself too.
My name is Melanie Hamburger. I work at the Marin City Health and Wellness Center. We also have a clinic in Bayview, Hunters Point. My question is that just at a meeting in Bayview yesterday, I heard about the National Parks Initiative to make sure every fourth grader has access to a free park for themselves and their family, which gives them access to all of the national parks around the country, and I haven't heard that come up today. So I was wondering if any of the parks prescription programs are taking advantage of that incredible offer.
So the question was, she'd mentioned that she'd heard about a program called Every Kid in a Park, which is designed to get fourth graders and their families free access to national parks. It's part of the Park Service Centennial. And the question was, for any of our panelists, have you been able to take advantage of that in your either health institutions or your park institutions? I'll just toss that up.
Oh, there we go. Okay. Well, at East Bay Regional Park District, we have 65 parks, as you heard, and we have 10 visitor centers. And for years and years and years, we've been entertaining and educating youngsters through a variety of ages at these centers. So approximately 50,000 kids a year are coming through our programs. I wouldn't say they're necessarily coming because of the fourth grade initiative at NPS, but it is certainly a nice way to dovetail efforts.
I think when we're done, if you'd like to talk a little bit about the Cities and Children's Nature Network and the 30 different groups that are involved in that, accessing schoolyard nature, park nature, making everything walkable and accessible, I'd love to have that talk with you.
Since our national parks folks, I think they are here on this panel, they would say that Christie Field is already free in terms of admission. But what we like about that is that the National Park Service has established a particular standard that is a policy, that there's metrics to it, and then there's indirect benefits of that. We're talking about it today, and we realize that it's a social justice issue.
Remy, has that
Well,
come into play in the city?
no, Melanie's from the clinic as well, from Marin City. So I'm just hearing about it with Melanie, but I think that as we're expanding, we've just expanded into Bayview's Hunters Point, that would be a great opportunity for us. I'm looking at Gabe, our health educator, and we'll definitely be looking into that.
The fact that you hadn't heard about this, we would call that a swing and a miss on our part, because you should have heard about it. Another question. Who has another question to this terrific panel? Tara.
Hi, I'm Tara Hansel. I work for the National Park Service. I'm wondering, beyond social media, what have you found to be the most effective way to get the word out and to bring folks into your program?
Beyond social media, how do you bring people into your programs? For us, it's word of mouth is probably our number one tool. Somebody tell a friend, somebody has a good experience, they go back, they tell a friend, and they bring a friend, right, Lise? Thank you.
Go ahead.
We have some outreach coordination and community connectors. We do have some people working through the public housing, so we've put up, whether it's flyers or just sort of doing that outreach in public housing to talk to people. That's a couple of the ways that we're doing it, and also just walking around, having our walks in the community so people can see us walking around the community and telling them when it is and to join us, things like that, just visibility.
Yeah, I think that's the power of us coming together here. The existing channels are going to communicate to people who already come to the parks. So, thinking about new partnerships with community organizations and governmental services like WIC and NEOP and CalWorks that reaches out to the population that's most stressed is one approach. Working with specific agencies that take care of our most vulnerable patients, for example, children who are in foster care, those who've been involved with the juvenile justice system. So it's how does, and public health actually does partner with many of those organizations already. So how does Park then partner with public health, then who can also partner with those organizations?
And I would just say that public education is probably the most important thing that we can do to continue these programs. There's a variety of levels of public education, so the traditional methods, as you were talking, social media, traditional media, most of us have activity guides and websites, but then there are some very specific audiences that we want to connect with. So whether it's through fairs and festivals that we send ambassadors out to, or park staff, or we have outreach specifically to community leaders. As I mentioned, one of our programs, the Multicultural Wellness Walks, does. The ethnic media are tremendously, I would underscore how successful it has been for us to create just identifying those leaders in your communities that represent different demographics and different audiences. That's really where you're going to make the biggest impact, in my opinion, for the targeted audiences.
Other questions? Eric.
Eric Rosegard, Department Chair of Recreation, Parks and Tourism at San Francisco State, and it's kind of a question for everybody. We have 1,400 faculty, expertise in 70 disciplines. We have over 30,000 students just at San Francisco State. Of course, there's UCSF, USF, Cal Berkeley, et cetera. And the question is, how can we partner up with San Francisco State? I know several of the boards, we have internships, but just getting your future leaders that will hopefully adopt the Healthy Parks, Healthy People. If I can get a raise of hands of how many students are in the audience here? Just raise your hands. So I encourage all of you to reach out to your students right here. Again, they're future leaders. They need volunteer hours. They need internships. They need part-time, full-time, seasonal positions. And they're here because they're interested in helping parks and helping people. And I just want to reach out and mention our fourth sector, education.
Well, I'd like to just give a shout out to SF State. We too do internship programs with your organization, particularly in the rec department. But we love students. We love students of all ages, and we encourage them to either volunteer, apply for a seasonal job. Those efforts will show park leadership that you really care and that you're really serious, so that when the full-time jobs are available, you'll be most likely right at the top of the list.
We have time for one more question. Then we have something special before we break for lunch. One more question. Yes, please.
My name is Sierra, and I work with Portola Family Connections, the education manager and manager of the Healthy Connections program. And Carol, you were mentioning the healthy outdoor wellness. I'm wondering, is that a curriculum that's available to download, or a free curriculum that you could offer in an after-school program, or I can implement in more of our school programs?
Yes, yes, yes. The way Kids Healthy Outdoor Challenge, or KHOC, we call it internally, was created was with academic teachers that represented elementary school level. Our program is targeted for third graders because we also have a variety of different level programming throughout our interpretive educational programs. So third grade was our target for this one. It was developed and vetted by teachers, by departments of education, and ultimately with the user teachers. So it is available on our website, and I encourage you to reach out to our staff. I believe that there should be some information there, or Dave Z is here, and he's our interpretive and recreation manager.